Well, ceasefires in effect in Ukraine once again after Russia agreed to establish an evacuation corridor to allow civilians to get out. But the Ukrainian government says it remains skeptical after Russia violated its previous agreements to halt fighting. This comes as the UN warns of a brewing humanitarian crisis with hundreds of thousands of people without food, water, or power. The World Health Organization established a warehouse at the border town of Lviv to deploy medical supplies to surrounding cities. Let's bring in the spokesperson for the WHO. We've got Tarik Jašarević. We've also got Anjalee Khemlani joining in on the conversation. Tarik, it's good to talk to you today. Let me just get your assessment on the ground. We've heard of the ceasefire holding so far. What have you heard on the ground? And does this give you enough time to get some of those supplies out?
Well, we are trying our best to bring in supplies that are crossing the border here between Poland and Ukraine. We are trying to get those supplies further to east using any modalities we can. We can't wait for these negotiated agreements for safe passage of civilians. We have to, Ukraine is a big country. There are places where we can bring supplies, and this is what we are trying to do. But situation is difficult, especially in places that are seeing shelling, attacks. Doctors and health workers are risking their lives to get to health facilities. Patients have to risk their lives to get to health facilities. And unfortunately, we are hearing and verifying reports that health care facilities have come under attack. Unfortunately, 10 people have been killed in those attacks on healthcare. Some of them have been health workers themselves. This really has to stop. First, attacks on healthcare are a violation of international humanitarian law, but it also deprives people of the access to healthcare services.
Some of these cities that have really been closed off, those like Mariupol, where there are reports of 200,000 people who don't have any access to food, water, or power. What are you hearing about your ability to get in and how dire the humanitarian situation is?
Sorry for disconnection first. Now, it's really difficult to get really into Mariupol. We are not in a position to enter the city. We are trying to get information. There were information coming out of a very difficult situation. Some of the health workers that I talk here in Lviv were trying to get some information, calling the hospital there, but it was very difficult. And there were recently reports of possible attacks that took place on the hospital there. Now, when you have a situation where you have intense shelling, bombing, and fighting, things are only getting worse with the time. Basically, there is more risk of health facilities being damaged. There is obviously increased number of wounded people that need treated. There is more difficulties to access health facilities, and really what we need is these facilities to cease. There has to be understanding that population not only needs to be able to access basic services, but also that populations should not be really living besieged and under bombs. Unfortunately, we as humanitarians, we can only call upon and try to use means where we can, but we can, as a humanitarians, we cannot stop bombs. But again, we will use on every level what we have at our disposal at WHO to advocate and to try really to do concrete actions. And I was today in our warehouse. We were putting supplies, these surgical kits and general essential medicine kits together, trying really to see how we can move them, where it is possible to go in this situation. But really, there is really no health without peace. What is needed really is peace.
Tarik, putting this all in context, Anjalee here, we're talking also about all this happening with the background of the pandemic still in play. Tell us about what you're seeing when it comes to testing and vaccinations and the attempt to sort of keep this virus from transmitting, even as more people are fleeing from the country.
Well, Ukraine was remarkably still doing surveillance and reporting numbers to WHO because there are still parts of the country where health system is functioning. And this really shows the resilience of Ukrainian health system. Now, Ukraine had less than 40% of people being fully vaccinated. Many of those who have not been fully vaccinated are over 65, and they are in increased risk of severe COVID-19. We know that some oxygen plants have stopped working, so there could be a shortage of oxygen, and oxygen is a critical tool to treat severe cases of COVID-19, but also oxygen is key to other health interventions, and we are trying to bring that oxygen in. But with the low level of vaccination has been disrupted in some places. With the lack of treatment capacities in the area where there is a conflict, we may have increased transmission of the virus. Virus, unfortunately, will not stop just because there is a war, and we understand that people have other priorities right now than to try to prevent the transmission of the virus. We should keep eye on this. I'm sure that Ukrainian health authorities are doing the best to try to treat those who need treatment for COVID-19. Vaccination should continue where it is possible. And obviously, we need also in neighboring countries where refugees are coming that COVID-19 vaccines are offered, and that there is a disease surveillance and screening, so we can know really if there is any increased transmission. But again, refugees should not be seen as a risk to neighboring countries. COVID-19 is everywhere, as well as the risk of other diseases. Really, we need to do everything to help people fleeing the country right now. And I've been yesterday at the train station here in Lviv, and it's really heartbreaking to see hundreds, women and children, trying to find safety by taking train to Poland. And it was also so inspiring to see Ukrainian volunteers, doctors and nurses providing first assistance to these people who have to leave their homes.
Tarik, I also know you mentioned that the attacks on the hospitals and the healthcare facilities. How is that disrupting your ability to get medical supplies further into the country? Because right now you're on the border with this new warehouse. Are there plans to try and get closer and set up maybe new warehouses closer to areas of need?
Well, we already had offices here across Ukraine before the conflict. We were there before the 2014 conflict. And in between, so it's a question really of having enough of security to be able to access our offices and our warehouses. We will do obviously our best to do so, and we'll use every opportunity to try to push medical supplies through first of all health authorities who have presence everywhere. Other partners who are also coming now, setting up medical facilities and ready to help. So we will be doing this. But just to come back to the issue of attacks on healthcare, WHO has mandate to monitor and report attacks on healthcare everywhere around the world, because this is really a violation of international humanitarian law. This is something that really puts everyone in a position where hospitals, places that people should receive not only medical care but should feel safe, are suddenly becoming a target. Mm-hmm. So this has to stop really, and we need to condemn these attacks and really voice our outreach, seeing that people who are seeking care are being attacked.
Well, Tarik, I know you're doing really important work there. I do hope you stay safe out there, and really appreciate your time today. Tarik Jašarević, he's the WHO spokesperson, and our thanks to Anjalee Khemlani as well for joining in on the interview.